This is One Voice Lenawee. Stay informed. COVID vaccinations and booster shots. How does this affect our children? Finances and the cost of living. Race and the fight for equity and equality. What will education look like in the future? What you should know about good health practices. Employment and job interviews in today's world. You need to know. Stay connected. One Voice Lenawee. Access to the information you've been looking for. Sponsored by United Way of Monroe and Lenawee counties. And welcome to One Voice Lenawee. So I want to welcome everyone to One Voice Lenawee. Glad to have everyone on the show today, and thank you all for coming. And this is a local talk show that cover important public events and topics throughout our community. And if you haven't already subscribed to our show, we are asking you to go ahead and hit that subscribe button right now. Don't think about it. Just go ahead and hit that subscribe button. And again, welcome to One Voice Lenawee. And we want to welcome our guests. We have quite a few guests here tonight. We have with us awesome troop under the direction of Michelle. That's going to be coming up shortly. And we also have with us Dr. Dennis Sherman, MD, Master of Public Health, Medical Director of Lenawee County Health Department, and has been working in Lenawee County for over 30 years. And we also have Martha Hall, Masters of Public Health, Lenawee County Health Officer, who has been working in Lenawee County for over 27 years. So we are glad to have our guests here with us today. We're glad to have the studio audience with us today. And we are going to go ahead and get started with the show. So again, thank you for joining us at One Voice Lenawee. We encourage you, we push you, and a little bit of pressure to hit that subscribe button and stay connected with what's taking place in our community and in our county. So we're really grateful for that. There we go. So Michelle, welcome to the show. Welcome to One Voice Lenawee.
Thank you for having us.
I'm just grateful to have you on the show as well. And just if you could just take a moment, tell us about Awesome Troop. What is Awesome Troop?
Well, Awesome Troop I created for a group of young kids, not just little girls, but men, little boys, and girls. And it's Awesome Troop, and that's in for all-American women and warriors who expect success and opportunity to motivate towards higher education. And we teach them to have total respect of other people. So it's just a positive group that we can come together with kids from all over Lenawee County. They have a sense of belonging, and we create dances for church groups, for praise and worship. We also perform at many and various nursing homes, and we do a lot of parades, and we used to go to the Boys and Girls Club. So just keeping it a connection of our positive young kids.
That is awesome. Michelle, how long have you been at this? How long has Awesome Troop existed?
Well, I started it for my daughter when I saw a need for it. She was 5, she is now 38. So around 34 years, going on 34 years, we have been doing this.
And Awesome Troop is comprised of various young girls from different walks of life, different backgrounds, different ministries.
Exactly, yes. We don't discriminate. It's a diverse group. So it's, once you see them, they're from all over Adrian. It's very diverse.
That is pretty awesome. Well, we have Awesome Troop standing right in front of me right now. So we're not going to hold up. We're going to go ahead and get the cameras over to Awesome Troop. And Michelle, thank you for sharing this awesome talent with us tonight. We really appreciate your dedication to community and to the youth in our community. So we're really grateful to have you here. We're really grateful for the work that you do in our community. And I know I can say with the surety that these young girls must be so excited to work with you and to have this opportunity to display their talents. So at this moment, we're going to turn it over to Awesome Troop.
And I'd like to thank you for the opportunity for letting the Awesome Troop perform here as well.
Thank you.
The spirit is made right. But sometimes the heart rim, the soul rim, the mind rim is a little slow getting the message because life has left a hole in it due to molestation, low self-esteem, abuse. But I came to tell you that God is coming to heal the hole in your soul. My sister Leandria is going to help me with this story. Take your time, sister. Sing it for somebody. Deliver me. Rescue me from myself.
'Cause all I seem to do is hurt me.
Anybody overthink a lot, that hurts you.
Hurt me.
That's right. Now let's take it up and cry out. Say, yes, sir.
Deliver me.
Take your time.
'Cause all I seem to do is hurt me.
Anybody out there got that message? We should be finishing it, but I need you to say it one more time. Try saying it. In my background, say it. Say it again, hold up. Rescue me from myself, from my overthinking. That's right. So let's take it up, choir. Let's take it up. We're singing this for somebody. Get down on your knees and just say it. If my people who are called by my name, you just sometimes get back down on your knees and pray and say, anybody got a witness out there? Anybody need the difference from yourself, from your overthinking? All right, this is it. Let's sing it out here.
That's awesome, guys. This is just, yes, that's awesome. That is awesome. That is awesome. Thank you guys for being with us tonight. Again, my head is off to Michelle for allowing the group to come and be a part of this show tonight. We're just grateful for the work that she continually does in community and her commitment to community as well. So we are glad to have our youth with us and just a showcase of their talent tonight. So again, awesome troop. Thank you again, Michelle, and we're looking forward to seeing greater things take place with our youth and the awesome troop team, and I'm sure we're going to have them back again on the show. So just grateful for that. And also tonight we have with us Dr. Dennis Sherman, Master of Public Health, Medical Director of Lenawee County Health Department, with us tonight as well. And we have Martha Hall, Masters of Public Health, Lenawee County Health Officer. So thank you guys for being a part of the show. Thank you for coming on and taking the time, I know, out of what has to be an extremely busy schedule to be a part of this program tonight. Some of the things that we were discussing, that I've been discussing in community, is we've got all these concerns going on. We've got all these questions that are taking place in our community, and the theories are kind of just migrating all over the community, and folks have this apprehension of regarding the vaccination. They've got these other concerns about COVID-19. What does it mean? What is it? How is it impacting our community? So I think it's really important that we connect with the right people to really get the proper information out there so that people can make an educated decision instead of just taking information that's kind of floating on social media and everywhere else in our community and not really understanding the truth behind the vaccinations, the truth behind COVID, understanding what the variants are, how it impacts our community. So again, I'm really grateful that you guys are taking the time out of your schedule to be on the show. So again, Dr. Sherman, Chernin and Martha Hall, thank you again for being on the show. Thank you again for being on the show. So I'm just gonna kind of toss some of these questions out there at you, and if everyone wants to respond, and I meant to do something about that. Okay, so here we go. So one of the questions that I've come across is, what is the best way for our community to protect itself against the spread of COVID-19?
Well, I'll start this one, and I'm sure that Dr. Truman and I can both provide some information here. I do want to just say, D'Angelo, thank you so much for having us on the show tonight, because I do think it's really important that people get information from reliable sources. And we all see there's all kinds of things out there on social media, but we're just grateful for being able to have that dialogue with you tonight. So what are some of the things that you can do to protect yourself against COVID-19? And I would say that the best tool in our toolbox right now is vaccination. We need people to be vaccinated. And, anyone who is 5 and older is eligible to be vaccinated right now. The vaccine is plentiful. It is available at many locations in Lenawee County. If you go to lenawee.mi.us and click on the box, the COVID box, you can go to a tab for vaccine, and it will list all the locations. It will even tell you which locations are doing the pediatric vaccination. So lots of good information there, but I think that is the most important tool in our toolbox is vaccination. And if you're someone who's already been vaccinated with your initial series and you are eligible for a booster, which, just recently, that means anyone 16 and older who was previously vaccinated, I would encourage you to get those booster doses. Dr. Chernin, do you want to talk a little bit about just some of the statistics that we're seeing with regard to vaccination in individuals that are with hospitalizations and death associated with COVID?
Sure. By the way, thanks you for having us on. It's great to be here, D'Angelo. And it's hard to follow that sweet dance with statistics about COVID, because I think all of us are kind of up to here with COVID. But it's important to understand. I have some statistics here from the New York Times fairly recently, and at least one dose, all ages, 71% of the U.S. population has had at least one dose. And 60% of the U.S. population is now vaccinated. This includes anybody from 5 on up. The kids that are under 5 have not been approved for vaccines yet. The good news is that between 95 and 99% of the adults over 65 have been vaccinated, which is great news because the people who are over 65 are most vulnerable. And 87% of those have been fully vaccinated. So the vaccine dosage is 2 doses and hopefully a booster. And about 200 million people now in the United States have gotten at least one vaccine, and 230 million people have had 2 vaccines, and another 50 million people have gotten the booster dose. So that's pretty good numbers, but it's not enough because we have a lot of vulnerable populations. About 87% of the people who are in the hospital now, and also those people who are passing away from COVID, which is a very serious disease, 87% of the people have not been vaccinated. So really, right now, it's a pandemic of the unvaccinated. So the numbers are staggering for the importance. It doesn't mean if you've been vaccinated, you can't get the disease, but it's much more mild when you have the vaccination. If you don't have the vaccination, you have the full-blown effects of the vaccine. Some of you may have heard about Omicron. It's, I think, one of the letters in the Greek alphabet. I think it's number 15, 13 or 15. It's similar to Omega in terms of that's what they're using for the nomenclature for the vaccines now. And so let me just explain a little bit about how the vaccine works, and then I'll talk a little about this variant called Omicron. So vaccines work because the virus itself has what's called a spike protein. You've all seen the little picture of the virus, and it has little peaks and points on it. Those are called spike proteins, and they get into the body when you're exposed. They attach to the cell membrane, and usually in the nose and throat and the lungs, the bronchial tubes, and they get inside the cell, and then they replicate inside the cell and cause the mischief that causes the disease. The lower your immune system, the more difficult it is to fight this off. So the vaccines work by, especially the mRNAs, we'll talk a little bit about that. That's the Pfizer and the Moderna, which is the majority of vaccines that we use in this country. And what they do is you inject this mRNA, this messenger RNA, it goes into the cell, and it produces it's called coding. It codes for spike protein, and the spike protein causes an antibody response in your body. So the body attacks this foreign substance. The good thing about mRNA, and even Johnson & Johnson, which is a DNA vaccine, it cannot cause COVID, but it creates an immune response so that when the body is now exposed to it, the body will fight off the infection by producing these antibodies, and they're called T cells, and they're neutralizing cells, and a bunch of other different kinds of cells, B cells. So it's very safe. No vaccine is 100% safe, but it's pretty darn safe. There's been hardly any major complications from the COVID vaccine, and it works remarkably well, especially for preventing serious disease. So that's a little bit how the vaccines work. So Omicron is a variation of the original Chinese variant that came to the United States, which is from the Wuhan province. And this virus has changed. The viruses have this natural ability to change, and it's called a mutation. So there's 30 different parts of this the COVID virus that has changed. So when it gets into the cell, it's a little bit different than the original ones. The vaccines seem to be working. What we're watching for is whether it takes over the Delta variant, which is the one that's been circulated. About 99% of all COVID viruses are Delta. But now we're starting to see it started in South Africa, and it's starting to take over Delta in South Africa. We have to wait and see. Here in this country, about 30 states right now have seen it. And the things that we're watching for are, one, we're watching for whether the virus is more pathogenic, meaning it's more infectious. More virulent, meaning it causes more serious disease. And then we want to find out if it's more infectious. Does it pass to more people more quickly? And the third one is whether it evades the vaccines. So we have very preliminary data. We have to watch it carefully. The CDC and the World Health Organization and all the scientists right now are watching very carefully, gathering the data to make sure that we understand what's going to happen. Right now, it appears that 3 vaccines, at least in South Africa, where it's more widespread, seems to be containing it to the point where the people are not getting as sick as they were before. So certainly it helps to take the vaccine. Even if it's not 100% successful in preventing it, it certainly can keep you from getting very, very sick. And that's the major thing we want to make. We want to happen for us is through the vaccine is to not die and not get very sick and get long-standing COVID.
Wow. Dr. Turner, I know there's probably just speculation or whatnot, but is there a possibility of there being other mutations after Omicron? Or
That's a really good question, D'Angelo. I appreciate that. Yes, there are. This is another reason, not only to prevent serious disease and death. It's a bad disease. I mean, 750,000 people have died in this country in less than 2 years from this particular virus. The less people who are vaccinated, the greater the chance that a new variant could form. The faster we get vaccinated, the less chances that the virus will stay in a body and create a situation where new viruses can mutate, especially in immunocompromised people who are sick with cancer and other things. They tend to get the COVID virus for longer periods of time. And so it gets into the body. The body's immune system is weak. That's when the variants begin. So that's what they think what's happened in South Africa, where the virus came from. The faster we get the vaccines, not only to this country, but to developing countries, whether it's Africa or Asia or South America, the more developing countries, it's essential that we get the vaccine to those countries as well, because that's where variants can more easily pick up steam and develop.
Oh, wow. You mentioned vulnerable populations. If you could just kind of walk me through that just a little bit. What would we define as a vulnerable population?
Well, probably the biggest vulnerable population is people who are older. Younger people seem to get this virus less often than older people, and at least symptomatic. They get infections, but they're not as symptomatic. So the older population, people over 60, 65, and older, are the ones that are most vulnerable. It was ravaged to the nursing homes in the beginning, and that wasn't even the worst COVID virus. That was the original one, and then the Alpha virus variant. So that's one. Anybody who has immune problems, such as people on chemotherapy, people on steroids for immune compromised diseases, things like arthritis when they're taking drugs that are suppressive. These people are also vulnerable, very vulnerable. Anybody that has an underlying health condition. Obesity is one of the major, it seems to be, physical ailments. I use obesity as an ailment because it really is. So people who are overweight are also more vulnerable. They have a higher rate of death. And two of the reasons are, one is that in fat tissue, there's a lot of receptors. They're called ACE2 receptors. That's the ones we find on the nose and the throat, where the virus attaches to. And there's a lot of these receptors in fat cells. And also in those fat cells, there are what are called macrophages, fat macrophages. And these macrophages hyperreact to the virus and cause an inflammatory reaction. So people who get very sick and people who are on ventilators and people who are dying because of these an immune response. It's called a cytokine storm, where the body just overreacts to the virus and causes inflammation, and things get really out of control.
What would you say to marginalized communities where people are still kind of coming together, where they may not have as much access to these resources, or maybe the access is there and folks are just not aware of it? Are we seeing a uptick in COVID positive individuals in those kind of communities as well? Maybe minority populations. Are we seeing anything take place in those communities?
Martha, would you like to respond to that?
Sure. So as far as recent, we are not seeing a significant increase in our minority populations, at least here locally. We have really tried to get out into the community and make the vaccine available, and also, working with trusted partners like yourself, D'Angelo, to try and help get the word out to the community and let individuals know that the vaccine is available for them, and try and make it available in as many locations as possible. Certainly there's more work to be done, and if there are opportunities for us to be able to have vaccine clinics in areas where individuals may feel more comfortable being vaccinated, we would certainly be willing to have those conversations and try and make that happen.
And Martha, are we seeing or is there any information or any data out there that would show us what the infected rate would be for our community, or what the vaccinated rate would be for our community?
Certainly. So there's a couple of places that I like to direct people to for information, some in-depth information. So if you're looking for what's going on with COVID transmission in Lenawee County, there's a site called mystartmap.info, and you can go in and look and see what's going on in the state of Michigan. You can look for the whole state. You can see it by region. You can see by county. Now, in Lenawee County right now, so the two factors that we look at as far as COVID transmission, the two things that we look at are the cases, so the weekly cases per 100,000. Right now for Lenawee County, we for December 2nd through the 8th, we're looking at 554.6 weekly cases per 100,000. And then the other thing that we look at is the positivity rate. So the number of tests that are coming back positive out of the total number of tests that are being performed. And right now our positivity rate is 18.7%, also for that same time frame, December 2nd through the 8th. Which is quite high. We would like to see that that positivity rate significantly lower. We'd really like to see it below 3%. And then, so that's a really great place to find that information as far as what's the risk of transmission in our community. Another site that I would recommend that people take a look at is if you go to the michigan.gov /coronavirus. There is information there that you can break down to the county level. There's everything from vaccination rates. There's a very nice dashboard for vaccination. You can break it down by age group and look at what age groups are being vaccinated. So what's the percentage in our community? Lenawee County is lagging behind the rest of the state when it comes to vaccination. And, we would really like to see those numbers increase, especially our younger population. We really need to see those numbers increase. A lot of our older adults, so definitely individuals 75 and older, 65 and older, we still saw a pretty significant uptake of vaccine. But with our younger population, we definitely can do better. So, really just encourage everyone to get vaccinated, get those booster shots. If you're unsure about the vaccine, if you have questions about it, and it's reasonable for people to have questions, but if you have questions, please reach out to your healthcare provider and have a conversation with them. Talk to the person that you trust with your other healthcare needs, and consult with them on whether they believe that it's the right decision for you to get the COVID vaccine.
So in our community, you said that the vaccinations are open to the populations of 5 years of age and older for the youth population.
Yes.
And I know that there are some of the vaccinations that require 2 shots versus just the 1 shot. When it comes to both shots, are we seeing the youth population that is receiving 1 shot or going for the 2 shots? Are they going back for both shots, or are we seeing them come in for the 1 and maybe not come back for the second one?
No, I would say that we have a really high percentage of individuals who are getting both doses of the vaccines. That's something that we've seen with the older populations. And, most of the time when individuals are coming in and getting those vaccinations, they are coming in for the second dose. And with our younger population, the vaccine that they can receive does require 2 doses. So the Pfizer vaccine is going to be a 2-dose vaccine. I also want to just mention that if you go to the lenawee.mi.us website and click on the COVID box, there will be a tab there for vaccines. You can find all the information there for when those vaccine clinics are offered. There's going to be one Wednesday, which is the 15th, from 4 to 7 at Springbrook Middle School. And that clinic is open to anybody. So if you're someone that needs your booster dose, they'll have all of the vaccines available. And they'll be vaccinating anyone 5 years of age and older. So that's a really great opportunity, 4 to 7 Springbrook on December 15th.
Okay. And with the booster shot, so we get the vaccination. So you go, you get your one or you get your two vaccinations. Then, and now we're hearing a lot of talk about the booster shots that we're expected to go take after so many months of having the vaccination, the Johnson & Johnson, Moderna, or the Pfizer vaccination. And are we looking to, will this work? The booster shots work similar to the flu shots, where every year we'll come back to receive another booster shot, or is it the vaccinations one booster shot then we're good, or are we looking to do this yearly?
Yeah, and I'm gonna let Dennis jump in on this, but I think that some of that is yet to be determined. You know, right now the scientists are evaluating the information, and you know, we don't know. You know, I've certainly read things about some talk about a possible fourth dose. I've I've read a lot of information out there. Dr. Chernin, what's your thought on where we're headed with this as far as additional doses?
Well, I agree with you, Martha. We don't know yet. I can say one thing: people are through social media and some of the people who are not interested in vaccines say, "Well, you said the government said that it was going to work with this vaccine, and now you have to have two, and now you have to have three. What's going on?" Well, it's very common for vaccines to have multiple doses of it. Take polio. We get 4 polio vaccines. Measles, mumps, rubella, we get 2. Diphtheria, DPT, we get diphtheria, tetanus, and pertussis, we get 4 by the time we're 5 years old. So it's not uncommon to get multiple vaccines. It takes a while for the body to prime itself. It takes a while for the body to develop the immunity, the strong immunity, the antibody response, their B cells, antibody cells, or T cells. It takes it has a memory, and so the body, you have to keep reminding the body in a way. We're hoping that 3 will be enough. The studies have shown that a third vaccine is very effective for boosting the immune system. It started to wane. A lot of the studies studies that came out of Israel, they were tracking very carefully. It's a smaller population, and we're starting to see that in this country and some of the European countries, as well as some of the Asian countries. We're starting to see that the third vaccine boosts up the immunity. Now, there's some caveats to that. There's some questions. One is, are there more variants out there? That's why you need to vaccinate, so there are less variants. It's really, really important. Everybody needs to get vaccinated. So that's an important factor to remember, so that we don't have to keep boosting up for new variants. Viruses are kind of tricky. They're like any living organism. They want to live. So the tendency is to want to not kill the host, but to transmit it to other people so the virus can continue to live. And so a smart virus tends to become less virulent over time, becomes less infectious and less dangerous because, as I said, every species wants to survive. So it doesn't help you if you kill your host. Like Ebola, we've all heard of Ebola.
Mhm.
And Ebola kills their host very quickly, and therefore it doesn't really spread very fast. You maybe have 100 or 1,000 people maybe, but it doesn't become worldwide because the virus itself isn't a very smart virus in a sense. But this virus is tricky, and this virus has figured out. I mean, it's not conscious like we are, but it is an organism that wants to, or actually not even an organism. It's actually a bunch of nucleosides and nucleotides and things, but it has an ability to want to survive. So we really, the point of what I'm saying is that we really have to protect ourselves. What are important? Vaccines to increase our immunity. We need to keep wearing masks. This is so important. I was just at a mall in Ann Arbor where the vaccine hesitancy is a lot lower. But I would say a good 2/3 of the people weren't wearing masks. Bad idea in an indoor place. I think you should, in my opinion, and I think most public health professionals believe this very strongly, anytime you're in an indoor situation and you don't know if people are vaccinated or not, you should have a mask on. Whether it's a mall or a restaurant, before you eat, where you go into a store to buy something, you should wear a mask. Social distancing, still very important. You want to have some distance. I get kind of nervous when I see these big sports arenas having 100,000 people without masks on. Now, some of them are outside, which is a little better because you have more ventilation. But I was actually very pleased at the Michigan game. I was watching the Michigan game, and everybody's masked in the Michigan stadium. I wasn't pleased with the outcome of the score, but I wasn't pleased because I'm a crazy fan of sports and Michigan in particular. But people were masked, and I think that's very good. In fact, if you're a student at University of Michigan, you have to wear a mask, and the professors have to wear a mask. And I think that's really a good idea. Ventilation also very important. The more you can, be outside. And obviously it's cold now, and that's why Michigan, by the way, has the highest rate, one of the highest rates in the country for COVID. And part of that is to do with the natural movement of this virus. It started from the south and came back north, went down south again, came back north. But possibly part of this is because we're inside now. So yeah, it's okay to be with a family or friends, or triple vaccinated, to be without a mask. And you trust who they are, but in general, if you're in a community that you don't know, because there's a lot of unvaccinated people, and you can pick up after you're vaccinated, you can pick up the virus. You may not get as sick because you're vaccinated, but you can transmit it to other people. So that's another caveat to this whole thing.
Oh, that's good to know. That's good to know, because I think sometimes that, and just in some conversations that you get folks that are vaccinated and they believe, well, I've got the vaccination, so there's no need to be alarmed. There's no need to take any precautions. But just having the information to know that because you're vaccinated, that you can still obtain COVID and spread it. So there are precautions that still needs to be taken, even if you're vaccinated. And so, what advice? Because I've talked to some folks regarding their children, and it's just a lot of conversation and a lot of concerns out there. So, what advice would you have for families that are apprehensive about their children receiving the vaccinations?
Well, I'll start, and Martha, you can pick up on this if you like, for sure. I have no hesitancy. I have 9 grandchildren, and the first thing I did when I heard that vaccines were now eligible for 5 and up, called my kids and said, "When are you get the kids vaccinated?" I mean, it's so important, because while kids have not been as sick as older adults, over 700 kids have died. It's now the 6th or 7th leading cause of death in children. It's not a benign disease in children. People can get very sick, and thankfully not as many people as is the older people. But still, it's very important. And then they can get the infection, and then pass it on to mom. Mom passes it on to grandma or grandpa, and then you have a more vulnerable population or somebody immunocompromised. So. The more kids that are vaccinated, it's not as easily picked up and it's not as easily spread if you've had the vaccine. It still can be. There can be, and you can also get a breakthrough illness, but they tend to be less serious, and you tend to not be able to pass it on as easily because the it's called a viral load, is lower because you have the vaccine. So that virus gets into your nasal membranes, and very quickly the antibodies start attacking it. So you may still get it infected, but the load of virus that is important to pass it on to be able to pass it on to people is lower, so you're less infectious, but you still can't pass it on. And so that's another reason why it's very safe. Yes, we've heard about myocarditis and the inflammation of the heart muscle in young men, older teenagers and adults, but it's actually pretty mild, and there's been no deaths from myocarditis that we've documented. And the rates of myocarditis actually from the virus itself are way higher than they are from the vaccine. So, Angela, I want to address something that you said before. What about communities, and how do you help communities who maybe don't trust the government as much? And we're part of the government. I think it's important to address this head on. There are communities, and they can be marginalized communities. They can be communities of color. They can be rural people who are very independent and don't believe government should be as big of a factor in there. I think we have to continue to address things like we're doing right now, to address communities that are a little less open to the idea of or maybe aren't sure, don't trust the science behind it. I can guarantee you the science is true and real, and there's nobody trying to trick anybody or heard anybody I mean, we're, you know, if medicine is a science, 97 or 8% of all physicians have been vaccinated. And so, I mean, these are the people hopefully you trust with your life and your health to make good decisions for you. I think if it wouldn't be that way. It would be, you know, much lower if the physicians themselves didn't buy into and believe in the vaccines. They're very important, and masking too. I mean, when I go see my patients in my office, because I have a family practice myself, I wear a mask every time. There's nobody that can come into our office without a mask. So I think, you know, in any hospital, any medical care facility, I mean, we're doing that to protect ourselves and to protect other people. And so, you know, I just want to stress that this is, you know, vaccines have been around for 200 years. And if you look back into the late 1700s, George Washington mandated vaccines, the smallpox vaccine, to his soldiers. And it caused an uproar then too, because smallpox was killing 30% of the soldiers. And it had just been developed. It came from cowpox. An interesting story in and of itself. But he mandated it, and it turned the course of the 1812 war, all sorts of wars that were fighting between the British and the Americans. So, I mean, it goes way back. In the 1918 flu epidemic, there was resistance to wearing masks then. It's very interesting to see the history of that. There's some interesting books on that. They didn't have vaccines then. That's why a lot of more people died during the 1918 epidemic than even now, in terms of percent of the population, because people weren't, you know, there wasn't antibiotics. A lot of people were dying of pneumonia that they developed after the viral infection, but also people were resistant to using masks. So this country has a very fierce independence. I mean, it's probably the most independently thinking peoples in the world right now, you know, of any country, I think. And so, but we need to listen. We need to listen carefully, get this thing under control, and get it to what we call an endemic state, where it's just like for the flu. It can be bad, but it won't be as bad, and it will be less in the population. I want to just say too, we've only eliminated one virus in the history of the world from the population, and I mentioned it before. It's smallpox. Smallpox has been eliminated from the plant. There's been no other virus that has been eliminated. Polio is almost eliminated, but it still has little pockets. Smallpox, we haven't seen a case of smallpox. One reason for that is kind of interesting, is because smallpox doesn't have an animal vector. There's no intermediate. One of the reasons we can't get rid of flu is because the birds and pigs carry flu. One of the reasons why COVID virus probably won't be eliminated, and we may need more shots as we go forward, is because there's animal intermediaries for this particular virus. So, and we're like deer. You know, 50% of the deer that we see around our houses, they probably have COVID right now.
Wow.
So vaccines are really important. It's the thing that we have that can really change this thing, get beyond where we are right now.
Wow. That's wow. I never considered that the animal population being carriers of it as well. Never thought about that. So for those of my viewers that are watching, that's some history for you. That's just to help bring some more awareness and understanding, so that you understand what we're up against, and why it's important for us all to work together to push for the COVID vaccinations, and to make sure that everybody have the right information, the correct information, reliable information from a reliable source. That's really important. I know that there's a lot of information going out on the web, on social media, and anywhere you look, that it is a lot of different theories out there. So the correct narrative and the educated information is what's really important for our communities. And I have one final question. Is it possible for the COVID vaccinations to create variants? If somebody is to take the COVID vaccination, can a variant come from that?
No, it's the opposite. Vaccines will actually stop variants, as I mentioned before. The longer you have COVID in a vulnerable population, the more likely there'll be a variant that will form. And I don't think Omicron is the last. But the more you vaccinate, the less chance that virus sits in somebody's body, commingle with another virus, exchange genetic information, and become a new variant. So the virus cannot cause it. It's not a live particle. It's just part of a virus. It's a little piece of it. The spike protein, the body reacts to spike protein. Spike protein cannot cause the disease, and it cannot create variants.
And again, Dr. Chernin, Master of Public Health, Medical Director of Lenawee County Health Department. I really appreciate you being a part of the show, sharing all this rich information and history as well. I think it's a really important aspect of this, just to have that history and the understanding of vaccinations throughout our history, throughout our timeline. So, and to understand how it worked, the problems that vaccinations had in past times as well, but the importance and the results that they've had over our history as well. So, and Martha Hall, Masters of Public Health, Lenawee County Health Officer, thank you so much for being a part of the show. Thank you again for taking your time out to be here and being willing to share information and bring light to a lot of these questions that, because the questions that I receive, I get from community. It's conversations that I'm having with folks, and when I'm engaging in these conversations, I'm just kind of taking notes. When I hear these different arguments come across, I just take notes and try to find individuals that are a reliable source that can address these questions. So I really appreciate both of you taking your time to be on the show. And before we close out, would you have any closing words, remarks?
D'Angelo, I do want to just say the one thing that I don't think we've really touched on much tonight is how important it is to get tested. So if you think that you've been exposed, or you've been exposed to somebody that is COVID positive, just really encourage you to get tested. We have a lot of testing opportunities available here in Lenawee County. Several of the pharmacies do testing. We have the testing that's done there at the transportation garage on Monday, Wednesday, and Friday. And again, all this information is on the website, lenawee.mi.us. But we have a lot of testing opportunities. So, if you have symptoms of COVID, if you've been exposed, whether you're vaccinated or not, please get tested. And if you test positive, please make sure that you're isolating and staying away from others, so that, we're not continuing to spread the virus in the community. I think all of us look forward to the day when we're no longer talking about COVID, and we don't have the concerns with COVID spreading in the community that we do right now. And we all look forward to that. So just want to really encourage everyone, there's really simple safety or prevention strategies that we can all use. Dr. Chernin's mentioned the masks a couple of times. I don't like wearing a mask, but I put one on when I go in the store, or if I have to go in someplace that's a public location. So, that's really important. Making sure that we're washing our hands regularly. I don't know that we've ever talked about hand washing so much. In the last 2 years, we've certainly heard a lot about washing our hands. Yeah. But it's such an important thing, and it's not just COVID. Hand washing is so important in disease prevention in general. So it's a really good habit to be in. But just some of those really simple prevention strategies. We're getting into the holiday season. People are gathering together with their families, with their friends. Try to spread out so that, bigger spaces are better than smaller spaces if you can manage that. Having increased ventilation, just opening up the windows a little bit. My grandkids will attest to the fact that, we frequently crack the windows. In fact, we always crack the windows when we're driving, because you're talking about a few people in the car. It's a closed space. So bring in a little more fresh air. And we can do the same thing when we're gathering together, over the holidays. So just really encourage everybody. Let's try and do this as safely as possible. If you have questions and you don't have a healthcare provider, There are nurses at the health department that would be more than glad to talk to someone about vaccination and provide them with information. I talk to people quite regularly. If you do have a healthcare provider, please have that conversation with them and see if they encourage you to get vaccinated. It's an important tool in our toolbox, and anything we can do to encourage others is really important.
Martha.
Thanks, Martha. I'd like to add one real quick thing.
Yes, sir.
Pharmacies are our allies. We're in a partnership with them. They do vaccines too, besides the health department. So lean on the pharmacies. They're doing a great job. And also, besides the PCR test that you can get at various places, pharmacies do sell the antigen test. And while they're not as sensitive and specific, as reliable as the PCR test that you can get at the health department and other places, they are a good screening tool. A lot of the schools are using that right now, the antigen test to show who's been not only has the disease but who's been exposed. So, and we've been working with the schools a lot with superintendents. They've been very helpful in helping to get the message across that masks are important and testing is important.
Okay, I was going to ask this question as well, Martha. If an agency was interested in becoming a testing site, or is it a possibility to partner with the health department with that? What would be the steps if an agency was interested in that?
So if there's an agency that is interested, we can certainly have that conversation and see, depending on what they were planning on doing. Are they looking at, testing their employees? Are they looking at being a site that's open to the public? And we could certainly provide some guidance on what they may need to do to be able to do that.
Okay. All right. Awesome. Again, Martha Hall, Dr. Dennis Chernin, again, thank you for taking the time to be on the show today. I really appreciate it. I know that our viewers appreciate it, and we've got some other channels that this will be broadcast on as well. I know the last show we did a small snippet just to give it a shout on TikTok and had 3,800 views there. So, So we know that it has the potential to really get out there into our community and share this educational information. So really appreciate it. Thank you again for taking your time. And just for my viewing audience, this is Dr. Dennis Chernin, with the medical director of the Lenawee Health Department that's with us, as well as Martha Hall, the Lenawee County Health Officer that's with us, that has joined us today. So if you have any questions, go ahead and put your comments down in that comment box. We'll be sure to get back with you as well. And there's a lot of resources out there to get the correct information regarding COVID and COVID vaccinations, and locations where you can get tested or where you can receive the COVID vaccination. So we want to make sure that we get this information in your hands and out to everyone in our community, because if we all work together to do this, just by us working together, we can bring this to a close, and that we can come to what I now refer to as our new normalcy for our lives, right? So be able to get back out and socialize. And I'm looking forward to that day, but we all have to work together at this as well. So again, thank you both for joining us tonight, and I definitely look forward to future conversations and stopping by to check out the Lenawee Health Department. I've been there in quite some time, so I may be swinging in just to bug you guys. So
feel free, D'Angelo. And we certainly appreciate your partnership. You've been a great partner, and it is so appreciated.
Yeah, it's great. And I'm honored to be on the show and to be part of this. Thank you for letting us come on. Thank you, Martha, too.
Thank you. And from our viewing audience, this is One Voice Lenawee, every second and fourth Monday, inviting you to join us and be a part of the show at any time. And if you have any questions if you have any questions out there that's, hey, this is my question, this is what I've been thinking about, this is what I'm hearing, and I would like to have this addressed, put it in that comment box. Let us get with the right individuals so that we can bring those answers to you, maybe on the next show. So again, this is One Voice Lenawee. Thank you for joining. Thank you for being a part of the show. Hit that subscribe button. Don't wait till tomorrow. Don't wait till later. My parents always would tell me, don't wait for tomorrow, what you can do today. Click that subscribe button today. Again, thank you both Martha Hall and Dr. Chernin for being on the show. And thank you guys for watching.